everyone, and welcome to the 2021 Respiratory Care Program pinning. In your book, it explains about the reasoning for pinning, what the pinning means exactly, and how very special today is for these 16 fabulous graduates. Before I begin with my hour-and-a-half speech, no, I'm kidding, obviously. I'm going to ask Dr. Cook, the president of STCC, to come up and say a few words, and then I'll introduce the rest of the stage group.
Thank you, Esther. Good evening, everyone. Lovely to see you, and exciting that we can start to bring some life and normalcy back to campus during this very difficult stretch we've had here. A few notes of thanks, if you will, to you, the family, and loved ones. What we know in a program like respiratory is how essential, how vital you really are. You really help these students persevere through these very rigorous programs, and I want to express my sincere thanks for all that you have done for your students through this program. Thank you very much. To our two very talented program leads right here, Esther Prelly-Brooks and Scott Frink, let me also say thank you so much for the way that you champion this very necessary program, and I'll talk a little bit more about that. But again, if we could just do a small round of applause for Esther and Scott, who are just true champions. And briefly, to our students, I have been thinking about you for a long time now. Over a year ago, when we were in a state of emergency, we were locked down, we had donated, if I'm not mistaken, our respiratory machines. And I thought, so what will we do when students come back? What will that look like? And how stunning it is to think about this particular program amidst a global pandemic that is about a respiratory disease. It's really made me have to pay attention to what this college does, and quite frankly, to the 16 of you, what you will be immediately contributing to a field that needs you desperately. So please know we are so grateful for your persistence, for your dedication, for your resolve through this program. We're thrilled about the impact you're going to have on our community. So thank you, everyone, very much. Thank you.
Well said. So let me just, I just thought that was the most appropriate way to begin our pinning. But I'd like to welcome, not only Dr. Cook, but Vice President DeBurley for joining us today, and of course our Dean, Christopher Scott. I think I'm blocking him here. And he is the Dean of the School of Health and Patient Simulation. And families, of course, friends that are here, and obviously these young people that we've spent 2 years with, and they were extremely wonderful years. I'd like to thank, I have to say a few thanks to our medical director. He's not here, Dr. Rodriguez, Miguel Rodriguez. In order for our program to run and be highly accredited, we need certain things in place for accreditation. One of the things we need is a medical director. We need a program director, that's myself, and we need a director of clinical education, and that is Scott Frink. And so those are the main focus. And not only does he, graciously become our medical director, but he also was an adjunct faculty for us. So he's not here, but we need to acknowledge him. Also, Carla Bouchard, Professor Bouchard to the students, because Carla just left Cooley-Dickinson as the director of the respiratory program at Cooley-Dickinson Hospital, took our students in as many as she could take during a pandemic when some hospitals wouldn't take us and some facilities couldn't take us, and not for any other reason but of protecting patients and the staff. Carla took our students in, and now she's moving on to Bay State Medical Center, and she's going to become the director of the respiratory department, Bay State Medical Center. And so we congratulate Carla on that. And Carla and I got our pins 25 years ago. 25 years ago today, we had our pins. Also, the hard work of our clinical instructor, Josie Zanoy. Josie came to us. We lost a couple of instructors after the summer, and Josie came to us, and we are so grateful. She has shared so much with the students, very organized, keeping them together, a wealth of knowledge, and she gave them a lot of guidance and challenging and very challenging and unprecedented times, keeping them safe at all times and giving them all the experience that they could get, which is very valuable. Our advisory board members, of course, we always want to thank them, and our clinical affiliates. Without the clinical affiliates, I don't know how we would get through an accredited program without them. And they help us turn out such well-prepared caregivers. Dean Chris Scott, he's been steadfast. I can't say enough of the support that we get from our dean. Not everybody can say, I really like my boss, but I really like my boss. I do. He's always there for us, and he covers our backs. If we needed something, it could be masks, it could be ventilators, it could be anything at all. Go to bat for us, back us up. We had Chris Scott, and so that was especially during one of these most challenging times that we've ever had. Lest I forget my partner, Scott Frank, who's been a great support. He's right there, offering experience and knowledge. He keeps the program running for these clinical sites. This has been a nightmare. I'm not going to lie, but he didn't miss a beat. Clinical rotations, testing, staying on the students. Did you get your COVID test? Is it negative? You can't go into these facilities without it. And it was quite a bit. And he somehow found a way to make it work. We talked about it. What could we do? You can't cut corners. There's no corner cutting in this field. We couldn't let students out of a respiratory care program with one corner cut. So there's been no cutting, but he found a way. I was thinking about it. He wrote this speech, and then I'm driving here, and I'm thinking, I'm like, what can I say? I mean, this has been a year and a half with a full summer of these students. They didn't miss a beat. They didn't miss a beat. These people really, really want to be a respiratory care practitioner. This is their goal. Nothing was going to stop them. Not a pandemic, homeschooling your children. None of that stuff was going to stop these guys from moving ahead. Some would have little roadblocks that come back. Roadblock gone. Like, I'm going to find a way to do it. And honestly, they blow me away. They really, really blow me away. And not only they're doing it, they're killing it. Like, they're getting some of the best grades I've ever seen during a pandemic as a respiratory student. So you should all be very, very proud of your graduates. So I love this quote, and I'm sure my partner, Dr. Cook, Chris, he's probably sick of hearing me say it, but one of my favorite movies is Mr. Holland's Opus. Now, if you haven't ever seen Mr. Holland's Opus, it's one of my all-time favorites. And in this, Olympia Dukakis is the principal, and Richard Dreyfuss he's frustrated because he's a musician, and he doesn't want to teach. He just doesn't want to teach. He's so frustrated. But she's leaving and she's retiring. And she says to him, a teacher has two jobs. Fill young minds with knowledge, yes. But more important, give those minds a compass so that knowledge doesn't go to waste. We spent, with these students, in their respiratory classes, 7,532 hours of time in respiratory classes alone. 60 hours spent in labs, just in labs, and 760 hours in clinicals, out in the clinical settings. That doesn't count. That's not even talking about their study hours, their core courses, their Englishes, their sciences, in order for them to receive this degree. It brings us here today to welcome them into the profession. And I couldn't be more proud to do so. We've challenged them both academically and emotionally, and they've persevered. Under normal conditions, this is a rigorous program. But add to it the stresses of a pandemic, I mean, that's a mic drop. I mean, what am I going to say? They had everything at them every week with a COVID test, every week with somebody emailing, you need this, you need that, lots of protection, you can't go there, we have to switch you out. They just went with it because they have their ultimate goal. They never lost their compass, and for that, I'm very proud of them. They never wavered. They had those tests every week in order to attend their clinical rotations. They had more demands and stressors than any other respiratory classes in the past. And I've been here a while to see that, and I was a respiratory student here, so I know what I'm talking about. They had children learning at home. They were teaching their children while they're learning and taking tests in a Zoom meeting. Family members who became ill, and they needed support from them, you name it. They had a lot on their back, and they did it. They're prepared to spread their wings and choose their path, of which there are many to choose. The job market is wide open. I believe anyone here that applied for a job has at least one job already and probably has had it for several months. The job market is wide open. The only positive aspect to the pandemic was the fact that the profession of respiratory care is on the map. We're alive and well, and we're needed. And that's the only positive to come out from our perspective. And we are in the forefront of healthcare. And respiratory therapists are needed in bedside care, acute, chronic, critical care units, diagnostic pulmonary laboratories, rehab centers, neonatal and pediatric care, sleep labs, education, and supporters for asthma education, tobacco cessation programs, home care, transport. I could go on and on. They can fly life flight. I have just a little thing that I found and I'd like to read is, being a respiratory therapist, you're called upon to assist those to breathe. It may be nothing more than a single wheeze. You're always there with ambu ready. You've learned early on your hands must be steady. Sometimes you intubate and place on a vent. Other times you extubate and know to heaven you sent. Your role is important and vital to all, which is why you are perked and listen for the call. So never underestimate the role that you play in keeping patients safe day after day. I have a few parting thoughts as you, the graduates, move on. Always hold to the gold standard. Okay? No one reaches for mediocrity. Reach for the gold, always hold to that standard. You shouldn't be dropping that ball now. Never forget the patient comes first. It's all about them, everything you do. Remember what it was like to be a student. When asked to take a student, show them your pride and lead by example. Advance your education and continue to learn and grow in the field of respiratory care. We got you going, you're going to be great, but always learning, always going. Remember, don't be afraid to put yourself out there. Be proud of who you are. And this honorable profession of respiratory care, because I know I'm very proud of being a respiratory care practitioner. It's one of the most fabulous things I ever did for myself, and I did it right here at STCC. And I welcome you. And in the words of Lady Gaga, I can't not have like some kind of good quote here, you know. I mean, some could do, you know. No, let's do Lady Gaga. You are the ultimate power, and you have never been so visible in the world. And that beautiful light and that rainbow is shining all around you. Stand in it, bask in it. In the words of, I'll do something like Winston Churchill, make you all feel better. Okay? We make a living by what we get, but we make a life by what we give. So God bless you and keep you safe, and may you grow stronger every day. Congratulations.
Good evening, everyone. Good evening, Dr. Cook, Dr. Burley, Dean Scott, all the family and friends here, and of course, our guest of honor, the class of 2021, and all those viewing on YouTube live stream. To say the last 2 years was crazy would be an understatement. Not only did you learn to become a respiratory therapist, but you also learned to become a respiratory therapist during a global pandemic. That's an accomplishment that no one can take away from you. You earned this. Your class has now set the bar. Be proud of it. And I could go on for an hour talking to you guys about what they did, how they got through this, but I'm not going to. I'm going to rewind for a second. I'm going to rewind about 2 years. I remember that first day together back in September of 2019. Seeing all your faces, all your scared faces. You're all petrified, not knowing how the next 2 years was going to be. Not knowing, was I going to make it? Did I make the right decision? To answer those questions 2 years later, yes and yes. You made it. You absolutely made the right decision to become a respiratory therapist. I want you all to remember a few things, just as I have learned from you. I've learned from you from the first day that I met you. Each and every one of you has made me a better teacher. Now I'm going to give you one last lesson. After being in this profession for a few years, I too still learn each and every day. Just because our tests are done, clinical's over, the grades have been submitted, our true learning never ends. It's honestly just the beginning. You all need to continue to learn, continue with your education. There's always going to be those teaching moments out there. And when you teach, you learn. I want you to remember where you came from. Remember your roots. Remember why you wanted to become a respiratory therapist. Don't ever forget that, and don't ever stop reaching for the stars. The sky is the limit for all of you. Remember what I always told you. Always be confident in yourself. Own it. Embrace it. Know what you know what you don't know. And if you don't know it, learn it, because someday you're going to need it. Remember those times in class. I'm sure a lot of you thought I was just nagging you, but I told you countless times. Follow our advice. Do as we say. Put in the work, and you'll be successful. Today is that reason I told you all that. For all those times I told you, this is the reason. Today. Today is the day you were rewarded for all that hard work. Never forget one of my many quotes from class. It's not what you say, it's how you say it. To all the family members in the audience, I want to thank you all for enduring the last 2+ years with your loved ones. I know it's been a trying time, entering this program from start to finish. It's no small task. I'm sure there have been a number of sleepless nights, staying up late, getting up early to study. I know there have been many times in the last 2 years your loved one's been a bit edgy, either from sleep deprivation or just plain out stressed and anxious, hoping to pass that test. To be honest with you, they had a reason. They had many reasons. Because this program is no joke, especially going through it in the middle of a global pandemic. So thank you. Thank you for being here tonight and sharing with them this special moment. Because each and every one of these future therapists has achieved a great accomplishment, and now is the time, tonight, to congratulate them. Tonight's the night we welcome them into the family as a respiratory therapist. Now my final words. Each and every one of you all share a bond as the respiratory care class, COVID class of 2021. You guys will actually have a bond throughout the United States, other RTs that have graduated at this time, because they all went through the same thing that you guys did. You all put the work in, you all shared the good moments along with the bad moments. You shed a few tears, you all laughed, shared many funny moments together. But the most important thing is, through it all, you did it for better or worse. You did it all together. Congratulations to you all. I am proud of each and every one of you, and you have earned it. Thank you. Now I'd like to introduce the class president, Tao Tai.
Welcome and thank you to everyone for coming out today to support our class. We are thankful enough to have this pinning to celebrate all of us here today. It's been an interesting time to be in school during this pandemic, and what a time for us all to choose to become respiratory therapists during a respiratory pandemic. On behalf of the class, I'd like to say thank you to a few significant people that have guided us through our program. The president and vice president of our college, Dean Scott, Medical Director, Dr. Rodriguez, Program Director, Professor Esther Pirelli-Brooks, Director of Clinical Education, Professor Scott Frink, and Professor Carla Bouchard. Also, thank you to our clinical instructor who has stuck with us from beginning to end. We are her first graduating class, Josie Zanoy. Not to mention the numerous preceptors that have taken students with them at every clinical site we have attended. Unfortunately, some of the people I've mentioned could not have been in attendance this evening. If it weren't for all of you, we wouldn't have been able to achieve our skills, not to mention get the hands-on experience and learn in our career. Fast forwarding to now, here our pinning ceremony. It was the fastest 2 years being in this program. To my class, we did it, you guys. We should be so proud of ourselves. From Zoom classes and social distancing, our clinical time together, we are officially done. It's been a long time coming, and at this time, I'd like to ask everyone to give a round of applause to STCC Respiratory Care Program's class of 2021 as we close this chapter and begin a new journey in our lives as respiratory care practitioners. Thank you.
Thank you, Tom. Okay, so we're gonna, well, I guess it's time to have pins. Yeah, they're like, yes. They picked the pins out themselves. They had a lot of say in it, and hey, they agreed on it. 16 people agreeing on a pin. It's never easy, okay? So we got it going. You want to start?
Yep.
You want me to?
First, Benjamin Barker. Next, Ayana Belnavis.
Yeah, you can take your mask off. Nice photo op, just for a minute. Yeah.
Next, Mr. Luis Cardona.
Connery Clark.
Mr. Robert Duquette.
Tatiana Arar. Tatiana Arar.
Miss Jenna Forward. Mr. Ryan Gola. Miss Amelia Gonzalez. Miss Kiara Gonzalez. Miss How Tu Lee. Ms. Savannah Loretto.
Talisha Moore.
Mrs. Colleen Sarno.
Miss Tao Tai.
Unfortunately, our last graduate was unable to attend, and that was Samuel Trombley. Pledge.
We're going to ask Dean Scott to come up and do the pledge with the students, so the students will stand. And he's going to say a few words as well.
You can sit down for a minute, so don't worry about it. I'll tell you. I promise. I know it's getting toward the end, so I'll be quick, I promise. But I want to take a quick second to thank each of you in the audience today. A, for accepting my email, giving you directions to get here and to get into the building, and also taking some time to go through that process. You know, obviously with COVID, we've really tried to make sure everyone's safe. So thank you for your patience and your understanding as you went through the process to come. Thank you to the students for doing it for well over a year now, and congratulations is the first thing I want to say to each of you. We're going to start in a second to do the pin. It's your last assignment from the faculty. Now, if we don't get it right, tomorrow morning you're back in Mega Codes with Sarah and Professor Frank. Okay? I just want to point that out. So let's make sure we get the pledge right. So with that said, I'll have you each stand, and we're going to do the pledge for healthcare professional. I'll tip you off here. I'll say the first line, you say the other lines, and then I'll finish with you. Okay? So this is really important. This is their oath, their pledge to respiratory care. And it's really the hallmark of what they're going to be doing the rest of their lives as respiratory care providers. So I'm going to start off and say the pledge for healthcare professionals. As a healthcare professional, I strive to Will you actively demonstrate your commitment to these responsibilities throughout your professional life? Congratulations. Have a seat.
once again, I just want to thank everyone for taking the time and to filling out forms and following all the procedures, but it definitely was worthwhile to have it here at the college, I think. I think the students would agree with that, and they're very happy to have you here. And I'd like to thank Dr. Cook and, of course, Dr. DeBurley and, our dean for taking the time out of their busy day, and, of course, all our crew in the back that make this happen. So I appreciate all of y'all, and stay safe and have a wonderful summer. Thank you. Good luck, guys.